Hey there, welcome back to the Men's Health Doctor YouTube channel. Today, I want to talk about something that might surprise you: testosterone. Now, I know what you're thinking. Isn't that just a male hormone? Well, here's the truth that not enough people are talking about. Women need testosterone too. In fact, it plays a crucial role in your energy, your mood, your strength, and even your confidence. If you've been feeling tired, struggling with low motivation, noticing changes in your body composition, or just not feeling like yourself lately, this video might have the answers you've been searching for. So stick with me, because what I'm about to share could genuinely change how you understand your own body and health. Before we dive deeper, I want to hear from you. Have you ever felt like something was off with your energy or mood, but couldn't quite put your finger on what it was? Drop a comment below and let me know. I read every single one, and your experiences help build this community of people taking charge of their health together. Now, let's talk about why testosterone matters so much for women. See, we've been conditioned to think of testosterone as exclusively masculine, but that's just not accurate. Yes, men produce more of it, but women's bodies naturally produce testosterone too, primarily in the ovaries and adrenal glands. And even though women have lower levels than men, that testosterone is absolutely essential for your overall well-being. So, what exactly does testosterone do for you? First, it's a major player in maintaining your muscle mass and bone density. As you age, especially after your 30s and into perimenopause and menopause, your testosterone levels naturally decline. This can lead to muscle loss, decreased strength, and even increased risk of osteoporosis. When your testosterone is in a healthy range, it helps you maintain that lean muscle tissue, which not only keeps you strong, but also supports your metabolism. Speaking of metabolism, here's something important. Testosterone influences how your body stores and burns fat. When your levels are optimal, you're better able to maintain a healthy body composition. But when testosterone drops too low, you might notice it becomes harder to lose weight, especially around your midsection, even when you're eating well and exercising regularly. This isn't about vanity. It's about metabolic health and feeling good in your own skin. But it goes way beyond the physical. Testosterone has a significant impact on your mental and emotional health too. It plays a role in your mood regulation, your sense of motivation, and your overall mental clarity. Women with low testosterone often describe feeling foggy, unmotivated, or just generally flat emotionally. You might feel like you've lost your drive, your spark, or that competitive edge you used to have. Some women even experience symptoms that look like depression or anxiety, when what's really happening is a hormonal imbalance that needs attention. And let's talk about something else that's important but often overlooked: your libido. Testosterone is directly connected to sexual desire and satisfaction. If you've noticed a significant decrease in your interest in intimacy and it's bothering you or affecting your relationship, low testosterone could be part of the picture. This is completely normal and nothing to be embarrassed about. It's a medical issue that deserves attention just like any other health concern. Now you might be wondering what causes testosterone to drop in women. Well, there are several factors. Age is the most common one. Your testosterone levels peak in your 20s and gradually decline from there, with a more significant drop during perimenopause and after menopause. But age isn't the only factor. Chronic stress is a huge one. When you're constantly stressed, your body prioritizes producing cortisol, your stress hormone, and this can suppress testosterone production. It's like your body is saying, "We're in survival mode right now. We don't have resources for anything else." Other factors include certain medical conditions like PCOS, although PCOS can also cause high testosterone in some women, so it's really individual, thyroid disorders, premature ovarian insufficiency, and removal of the ovaries. Certain medications, particularly oral contraceptives and some treatments for other conditions, can also affect your testosterone levels. And lifestyle factors matter too. Poor sleep, lack of exercise, inadequate nutrition, and being significantly overweight or underweight can all impact your hormone production. So, how do you know if your testosterone might be low? Well, the symptoms can be pretty broad, which is why it's important to talk to a healthcare provider rather than self diagnosing. But some common signs include persistent fatigue that doesn't improve with rest, decreased muscle mass or strength even when you're exercising, increased body fat, especially around the abdomen, low mood or increased feelings of depression, difficulty concentrating or brain fog, decreased bone density or increased fractures, low libido or reduced sexual satisfaction, and just an overall feeling that something isn't quite right with your energy or vitality. If these symptoms sound familiar, please don't ignore them. The first step is getting your levels checked. This means asking your doctor for a blood test that specifically measures your testosterone levels. The timing of this test matters. Testosterone levels can fluctuate throughout the day and your menstrual cycle, so your doctor will know the best time to test. It's also important to test free testosterone, not just total testosterone, because free testosterone is what's actually available for your body to use. Now, here's where it gets tricky. The reference ranges for women's testosterone levels aren't as well established as they are for men, and what's considered normal on a lab report might not be optimal for you. This is where working with a knowledgeable healthcare provider who specializes in hormones becomes really important. You want someone who will look at your symptoms alongside your lab results, not just dismiss you because your numbers fall within a broad range. If your testosterone is indeed low, there are treatment options available. Hormone replacement therapy for women can include testosterone, though it's not as commonly prescribed as estrogen or progesterone. The treatment usually involves low doses through gels, creams, or pellets. It's important to note that testosterone therapy for women is still an evolving area of medicine, and finding the right provider who's experienced in this area is key. But before we jump to supplementation, let's talk about natural ways to support healthy testosterone levels, because there's actually quite a bit you can do through lifestyle changes. First, prioritize strength training. Resistance exercise is one of the best natural ways to boost testosterone. You don't need to become a bodybuilder. Just incorporating regular weightlifting or bodyweight exercises into your routine can make a real difference. Aim for at least 2 to 3 sessions per week. Second, manage your stress. I know that's easier said than done, but it's genuinely crucial. Find stress management techniques that work for you, whether that's meditation, yoga, time in nature, journaling, or therapy. When you lower your chronic stress levels, you're giving your body the signal that it's safe to produce the hormones you need. Third, get quality sleep. This is non-negotiable. Your body produces and regulates hormones during sleep, and chronic sleep deprivation wreaks havoc on your entire endocrine system. Aim for 7 to 9 hours of quality sleep per night and prioritize good sleep hygiene. That means a cool, dark room, consistent sleep schedule, and limiting screen time before bed. Fourth, look at your diet. Make sure you're getting enough healthy fats. Your body needs fat to produce hormones. Include sources like avocados, nuts, seeds, olive oil, and fatty fish. Don't fall into the trap of extremely low-fat diets. Also, ensure you're getting enough protein and not chronically undereating, which can suppress hormone production. And don't forget zinc and vitamin D, both of which are important for testosterone production. You can get zinc from foods like oysters, beef, pumpkin seeds, and lentils. For vitamin D, spend some time in the sun when possible, and consider supplementation, especially if you live in an area with limited sunlight. Fifth, maintain a healthy body weight. Both being significantly overweight and being underweight can affect testosterone levels. Focus on sustainable, healthy habits rather than extreme dieting, which can actually make hormonal issues worse. I want to emphasize something really important here. If you suspect you have low testosterone, please work with a qualified healthcare provider. Don't try to self-treat with supplements or products marketed as testosterone boosters. Many of these are unregulated and can be dangerous or ineffective. You deserve proper testing, diagnosis, and treatment from someone who understands women's hormonal health. The bottom line is this: testosterone isn't just a male hormone, and it's time we stop treating it that way. Women need testosterone for energy, strength, mental clarity, mood, bone health, and overall vitality. If you're experiencing symptoms that suggest low testosterone, you're not imagining it, you're not being dramatic, and you deserve to be taken seriously. Your health matters, and addressing hormonal imbalances can be truly life-changing. So take that first step. Talk to your doctor, advocate for proper testing, and don't settle for being told that feeling exhausted and unmotivated is just part of being a woman or getting older. You deserve to feel vibrant and strong at every age. Thanks so much for watching today. If this video was helpful, please give it a thumbs up and subscribe to the channel so you don't miss future videos about taking control of your health. And remember, drop your thoughts in the comments. I'd love to hear about your experiences. Take care of yourself, and I'll see you in the next video.